Welcome back, guys, to another episode of Hormones Happen. I'm your host, Jeremiah, also known as the Optimized NP on TikTok. And today, we're joined by a very special guest who represents exactly where modern medicine is heading. She's a licensed PA with a background in general and vascular surgery, as well as emergency medicine. She's a passionate advocate for functional medicine with advanced training in bioidentical hormone replacement therapy and anti-aging procedures. I present the founder of Vital Life Infusions, Courtney Contreras. Thanks for joining us.
Hey, thanks for having me. This is great.
Absolutely, absolutely. So with such a diverse background, kind of all over the place, like what inspired you to branch out and open up your own DPC?
So I would say, necessity is the mother of creation, right? I actually had that day in clinic where I was like, I'm leaving this all on the table and I'm leaving. And I can tell you the day because it was one client. I had a 15-minute window to give her a surgical consultation for breast cancer. So nobody had talked to her about her biopsy results. She didn't know why she was coming to see surgery. She just thought we were going to kind of review a few things. And I'm in there and I'm like, you have breast cancer and we need to talk about mastectomies, double mastectomies, complete. And I was given 15 minutes. And I was like, I mean, 15 minutes, she's not even done crying. She has a spouse with her and they're just, and I'm like, I got a clinic full of 44 people I have to see today. And I walked out of that room after we did everything that we needed to do. And I walked right into the next room. And in this role, I'm working in surgery. And my patient who had a CT, abdomen pelvis, because they had insurance, they were charged $5,000 for their CT. And the cash pay price was $300.
Yep.
Now they couldn't afford to even do the procedure and have the follow-up care, and they were just distraught, and there was nothing they could do, and I just walked out, and I came home that night, and I was like, "I hate my job.
Yeah.
I absolutely hate my job." I'm like, and I don't hate people, and I don't hate healthcare, but I hate them all right now, right? None of this is working.
Yep.
Administration won't listen, right? There's nothing that they can do. They have to run a hospital clinic. And I just feel like as providers and doctors and PAs and MPs, we were getting oh, my doctor doesn't want to help me. And I was like, that's so far from the truth. And I just don't identify with that. And I did. I went in and gave my notice. And I had already started kind of picking up an IV therapy clinic and working a little bit into that. And I just decided to make that my direct primary care model. And it just grew. And I was like, this is such a better lifestyle. My clients are membership based. They pay a fat membership to see me. They don't get bills when they see me in clinic because it's all included in their membership. I have 30 minutes to an hour with every patient. And now they see me to optimize their health and look towards longevity versus sick care. Right. And, I
Yes.
live in rural Arizona and I can offer this in an affordable way that gives patients an option. And we have a huge working class population here that are sort of somewhere between I can't afford this kind of healthcare and I don't meet the requirements for free healthcare. And now there's like not only a service, but it's a high quality service, right? They have text messaging and messaging available. We have a small clinic, no wait times. And I can practice functional medicine in this setting because I'm not restrained by what insurance allows me to prescribe. So
I love that.
it's great for me. It's great for my patients.
This is absolutely the type of care that people deserve. Us being people, we deserve this. We deserve to have some say in our health. We deserve to have some convenience. And the reality is with insurance, I've seen it many, many times. You have these ethical problems where you know what to do, but someone else who may not even be medically trained is telling you, sorry, you can't do that because of the money. And it's just so disheartening to think, what difference am I really making here? I'm not making a difference at all. And you feel just torn. Just there's a duality between doing what you know is right, but also at the same time having to appease people who are telling you what you have to do. And I think that the
Right.
DPC really closes that gap. And so for those at home that may not be familiar with that, Courtney, how would you describe a DPC model?
So the terminology is really specific. DPC stands for direct primary care. But the best way to explain it is that it's a membership based healthcare service. So you pay a membership to be a part of your doctor's patient panel or your provider's patient panel. And then you see them as much or as little as you like, depending on the plan that you've selected. So I do have a lower ticket plan, so to speak, that makes it really affordable. That includes just an annual checkup and a follow-up checkup. So for people that think, oh, I don't need to see the doctor that often, or that's just not the way I want to take care of my health, right? So we have a plan for them. And then I have a plan for people that love to check in once a month, whether they have weight loss goals or hormone optimization or something that requires the opportunity to talk to your provider. Maybe they have a long laundry list of medications and they're like, "Hey, I want to talk about the opportunity to maybe diminish this list a little bit. Let's take one at a time,"
Right.
right? That requires multiple visits with your provider to say, "Hey, we just reduced this dose a little bit. Is your blood pressure well controlled? Hey, you lost 20 pounds. Do you really need your blood pressure medication? Hey, your cholesterol's back in check now that you're on hormone therapy. Do you really want to stay on a statin?" Right? In this practice, because people have already budgeted for their healthcare, they just show up to optimize their health. And it's a whole different look on healthcare.
Yeah, that's amazing. So what you're telling me is you can actually spend more than 10 minutes with a patient? Oh, that's crazy. Who would have thought that we'd
I
get
know,
to a
right?
point where that's even possible, right?
I just remember when I had worked in a family practice clinic, I remember a doctor saying to me, "I don't know what this guy's going to talk about for an hour. That would be completely unrealistic." I have patients that push that hour because they're like, "Oh my God, you're going to let me talk about all of this?" I'm like, "Yes, because it's a whole picture. I care that your foot is swollen and that that you're having hot flashes at night, even though they're seemingly unrelated. I care about both."
Yeah, and to a point, that's therapeutic too. Just being able to talk to someone and actually be heard, right? That's the biggest thing. Being heard, being validated. Because the reality is, no one cares what you know until they know you care. That's the most important thing. And if they're not convinced that you care, they don't really care what you know. They can find that information online. Now, what are some things not having, the constraints of insurance that you're able to do that you wouldn't otherwise be able to do?
Right. So in the insurance world, you would be really limited on imaging's probably a big one for my ladies, right? So the Western world suggests mammogram once yearly. Well, a lot of ladies would prefer to have a breast ultrasound or they want a different schedule. So we can talk about that and then find them a cash pay price for affordable imaging. I would say in hormone health, we talk about the importance of regular screening for mammograms, but a lot of women want to do this differently. And if they don't feel like they can have that comfortable conversation with their doctor, you're leaving them to resort on the internet by untrained professionals. So you may as well let them have those conversations in your office, give them the information and the data, and then offer them a cash pay price. Be like, "Hey, let me help you find somebody." And in this model, I have time to do that. I have time to call around and find out what's the best option for them and help them look things up and give them some resources. Prescriptions for hormone therapy, right?
Hmm.
In a lot of women, their insurance will not pay for their hormone therapy unless it's been a surgical menopause, and then they only want to pay for estrogen. And then the only
Crazy.
prescription testosterone in a lot of these women that's available is to use, the men's compounding gel cream, androgel, because that's the only one that's
Right.
available at pharmacies. And, there are a lot of other options for women, right? And there are a lot of affordable options for
Huge.
women. And they're just not FDA approved for women. But like, how many FDA approved medications have been out there and then recalled 7 years later?
Right.
I mean, not that the
Exactly.
FDA
Yeah.
doesn't have a very important job, but if we're guiding people by those guidelines, can we just talk about how many times they've been wrong?
Just one more barrier to care. That's it. I mean, the FDA, there's a lot of financial lobbying from the pharmaceutical companies and stuff. So, I mean, I think that most of my listeners you'll find are probably not a huge fan of the FDA in general. But, you're right. Having these joint decision-making processes with the patient and allowing them to make an informed decision, that's huge, right? I always like to tell my patients, you're driving the bus. I'm in the passenger seat giving directions. I may say, hey, I think we should go right. But if you say, I want to go left, and you can tell me why you want to go left, and it's safe, guess what? We're going to go left because I think that it's a basic right to be able to have some say in your healthcare. It's your health. And regardless of what you read or what you know, no one knows your body more than you. That's just the absolute fact of the matter.
Right. I mean, you have to take into play somebody else's, not so much their morals, but their lifestyle choices, right? And then if they can't have that comfortable conversation with you, who are they going to have it with, right? If you want to schedule out your vaccines or you want to choose not to have them, wouldn't the best
Hmm.
person to talk to be the person that is probably spending the most time and energy being educated? And if you don't create a welcome environment for that, the traditional model just doesn't allow you to give the welcome environment, right? It says follow
Doesn't.
this algorithm, otherwise insurance isn't going to pay.
Yeah, exactly. It's just so cookie cutter. It's so just conveyor belt medicine, essentially. But I know you do hormones. Did you start hormones initially when you started the clinic, or was that kind of something you started after the DPC, or was it all intertwined?
So it was kind of an altogether thing, but my hormone story is actually personal. So I'm 45. I don't mind saying my age, and I worked night shift in general. I mean, I worked general vascular surgery 40 plus hours, and then moonlighted in the ER, and I was probably pulling in 60 to 80 hours a week. Stress and night shift definitely triggered my early perimenopause. So I'm really well connected. And at this point, I wasn't doing functional medicine. So this was 5 years ago. And I started to have a lot of interest in it, but I wasn't practicing it. And so I was like, you know what? I definitely know that this is a hormone thing. I'm going to go to the people that I think would help me. So I went to my primary care, I went to an OBGYN, and then I went to a women's healthcare specialist. I was prescribed or I was offered an antidepressant. I was told I need to just take more time off work because I'm not as young as I used to be. My personal favorite, I hope your listeners aren't completely offended by this. My OBGYN told me my vaginal walls were amazing and there's no way I could be perimenopausal.
Never heard that one before.
I'm
That's a
like,
new one for me.
yes. I mean, it
Okay,
was new to
thank
me
you.
too. And let's see, I got labs, I got all these things, and everyone says, you're normal, you're too stressed out. Because at that time, I'm still going to the gym. I'm still working, 40 to 80 hours a week, depending on the week. I was still, fine. They're like, oh, you're just tired because you overworked. I'm like, no, I'm telling you, something is wrong with me. I'm not responding to people the way I used to. I'm emotionally not the person I was. I had been to HR 3 times, and I've never been to HR in my life
Jeez.
because they're like, "You are just entirely unapproachable." And I did, I just
Right.
had this rage inside of me, and I couldn't place it. My poor family was suffering, and I started to say, like, "Something's wrong with me." So that's when I started getting into hormone therapy, and once I got my hormone balance, I'm like, "Oh, this is the me that I used to be." I forgot that I could sleep at night without sweating. I forgot that I could take on tasks without being mad at the people I love. I forgot that I had patience and my ADHD wasn't on fire and all these things. And I was like, I went to 3 professional, board certified physicians and none of them had suggested that for me. And I was like,
Wow.
there are women that feel like me and have been unvalidated. And I never saw myself in women's healthcare. As a matter of fact, I was probably a horrible provider in that respect before this happens to me. And I hate to say that about myself, but that's the humble truth. One of these people that were like, women don't feel that way. It's an act, or, like I would invalidate them because I didn't feel that way, right? I had a female cycle and no problems and a few pimples when I got my period. And I was like, you deal with it. No, this was entirely different. The human I am now that my hormones are balanced is entirely different than the human I was as they were falling apart.
Isn't that just amazing? What a profound difference that can make. I mean, that could save someone's life. That could save a marriage.
It could have saved mine if I would have done it earlier, probably.
But,
I mean,
you were too
I
busy
feel
being told
like,
you're normal, right?
yeah.
Quote
I mean,
unquote
I
normal.
just
So
everyone
dangerous.
thought I tell you what, I had never felt so unnormal to my baseline, and then to have people tell me that, "No, this was just the future of what my life had to look like," was devastating.
Jeez, horrible.
And
That's
I was
the
like,
most terrifying thing ever.
right, and I was like, "Am I ever gonna feel happiness again?" Right? Like, it was gone. It was gone to me completely. So when a woman comes into me now and she looks at me and I ask her what's wrong and the tears just come down before she can put words to it, I'm like, "I know what's wrong. We're gonna work on it and we're gonna get you back to where you wanna be." And I think probably the best feeling I ever had was about a year ago. A woman had come in and she had kind of had the same story. 3 doctors, nobody was helping her, and she walks in and she was very depressed, and she goes, "I don't really think you're gonna be able to do anything else for me because nobody else has." And I was like, "Okay. Are you willing to give me a chance?" And she was like, "Yeah." The next time I saw her was a month later, and she tackled me in the hallway with the biggest hug, and then just tears came down her face. And I was like, "Oh," she's like, I'm not there yet, but I'm so much better than I was. And it was like night and day difference for people. Like they are enjoying their lives again. And if we could just bring that awareness to hormone replacement therapy for women and stop discounting their symptoms as it's just age or it's normal or, I think the term gaslighting gets thrown around a lot. Right. But really what it is, it's like, no, you were just waiting for someone to hear you.
Who doesn't want to be heard? When there's something wrong, who doesn't want to be heard? You've lived in that body for so long. You know if something's wrong. If we're saying, hey, you're normal, and you're like, I'm not normal, guess what? You're not normal. Something is wrong. And it
Right.
requires some intervention, right? We need to work on these things. And that's where listening really comes into play. When I first started the clinic, it was actually a men's only clinic. It was Still City Men's Health and Testosterone. Now, despite that name, I still remember very vividly, I was in my office and I had a female call, and it wasn't unusual for someone to call for their husband, but she sounded very tearful on the phone. And she said, look, I know you only treat men, but I am desperate. I need help. I need hormones. No one will help me. Will you please just do something for me? And that's really when, for me, the light bulb went off. And I actually got a little emotional because, I'm not a female. I'm not going to try to pretend that I've gone through menopause or anything, but I've seen this in my mom, my aunts, my grandma. I've seen this pattern where you lose yourself essentially. And it's like, what's going on? Why are they so different? Like, is it depression? What is it? And at the time, you don't know. But then I did some research, tons of research. I dove in deep. Now, needless to say, now I treat more women than men. And I can absolutely attest that the best feeling in the world is just getting a text saying, I feel normal. I feel normal again, and that's just so amazing. It's just validation of like, together, me and the patient, we take a chance. We walk the road together to get you to this point. It's not just me. It's not just you, but it's both of us getting you there. Right. And that's what you do
Yeah.
as well.
Oh yeah. I had a gentleman buy me. I live in a small town, so it's not uncommon to know, run into your patients in town. I had a gentleman buy me a cup of coffee the other day, and he tipped his hat at me, and then I saw as he was leaving, his wife was my patient. And he just said, "Thank you," and I didn't have to ask why. I'm like, "Oh, you guys got your life back together," because it's like it requires that spousal or partner support, whatever it is, and when your partner looks at you and goes, "Is it me or is it you?" and you know it's you, but you can't understand why, it's the most
Right.
defeated feeling ever, right? It's like, "What
Yep.
is wrong with me?"
Yep.
And they want answers just like you do, and it's like, I think now, so I have a young daughter, she's 15, and she watched me go through this. So she's gonna enter the world knowing that when she doesn't feel right, she's gonna be able to talk to somebody. But my generation, I grew up and joined the service at 17, and I don't remember watching my mom go through it, right? I remember calling her occasionally on the phone, check back in, and she'd be like, "Oh, I had a hot flash." But that's really all I knew about it, right? And it wasn't until I started seeing myself completely change and my personality change and my ability to tolerate anything at all was, like, crazy, and then how many women do this for so long because they just keep putting it off, right? Maybe I'm just tired today, maybe I'm
Hmm.
overworked, maybe I have a lot on my plate, maybe I'm not getting enough sleep, maybe I'm aging, that's weird, where did that 10 pounds come from, right? Like, oh,
Right.
maybe I didn't eat right, and
Yep.
before you know it, you've been living with these symptoms for 10 years, and you're a shell of the person that you used to be, and you don't even recognize yourself. And so a lot of times I'll talk to women, and I'll be like, "Do you feel good?" And they're like, I don't know. I don't know what good feels like. And it's like, okay, well, tell you what, let's keep moving in that direction. And then the minute they start to feel, they'll like kick a memory, like, oh, I remember when I felt like this. Oh, there is a better. Let's keep going, right? And adjust their dose and make those changes. But it requires the ability to check in with your provider often. And it requires the ability to have the time to listen and then the knowledge to stay up to date and the guidance, right? I mean, when women's testosterone came out, it was like, "Oh, we're only using androgel." And then it was, "Oh,
Yeah.
there's compounded cream.
Horrible.
Oh, there's injectable." Right? There's all these ways to use it.
So many.
And then, even adjusting your base in your cream can be different, right? Where are you
Yep.
applying it?
Yep.
What are you putting it on? What do you have to worry about? Do you have to worry about partner transfer? Do you have grandkids at home that you're holding, right? First is the decision like, is hormones the problem? Right? So we rule out all the scary things, right? So you have palpitations, you make sure that you're ruling out EKG, ruling out heart problems, right? Even though you probably have a suspicion that her heart palpitations came on with her perimenopause symptoms, it's likely estrogen related. But in this modality, you get to do all of the right things in the right order and give the patient the decision to, do we get you with cardiology, put a Holter monitor? Okay, cardiology says nothing's wrong. Now we've decided it's a hormone problem. Let's work that direction. Okay, now that we found out it's a hormone problem, how do you want to replace your hormones? What options are there for you? What can you
Yep.
afford? Right? There's so
Options. Yep.
many different things to talk about. And that alone, after you're done with the diagnosis and you've decided that you want the modalities of delivering hormones itself is a 30-minute conversation. Where is your
Yes,
primary care
absolutely.
supposed to put that? Right? Where is
Yeah.
he supposed to
Not
put that
possible.
in his or her day? It's not possible.
Not up.
And
Not.
so
It's
it's
not
not
possible.
that your traditional doctor doesn't want to help you, it's that the system isn't designed for them to help you.
Yep. Yeah. And one thing I'll say too is it requires courage, right? It requires courage of us as providers to say, hey, you know what? You're not just a patient population from a study. Studies don't encapsulate everyone. We have to sometimes make
Right.
critical thinking decisions and say, you know what? This may not be found in a study, but if this is what's going to help you, let's try it. That's what we have to do is everyone's different. And sometimes people don't read the textbooks. And so we really need to critical think that. And it requires courage because all through medical training, they're always like, if there's no study to support it, if there's no, anything to support your decision, you're in hot water. Well, guess what? You know what? At the end of the day, we're helping people. That's really what matters. And they're never going to do studies on optimization.
Right. Right. I think I was just watching one on ladies' testosterone and serum levels, right? We have done serum level testing on not optimization, right? Because what does optimization mean for me? And I'm so uniquely individualized, my stature, my muscle mass, my stress levels, right? What my total testosterone, my free testosterone, and my sex hormone binding globulin, which at the end of the day tells everybody how much you have available circulating in your blood, and then your metabolism and how it's going to use that. There is not another human on this earth that is going to have the biomechanics that I have, that is going to be able to deliver a study. What cycle day was I on? How many cycles do I have left in my system, right? And that's really why women were excluded from studies in the first place. We were the variable. We couldn't be a constant,
Yep.
right? If you had 20
Right.
women in a study, you don't know who's cycling when, what other factors are playing, and you can't really test that every day, right? That's why women
No,
weren't even
you
included
can't.
in studies. And then to bank a massive study on one of the biggest failures for women, and then black box
Yeah.
warning everything, and then 75% of those prescriptions were canceled overnight when it aired that that study
Oh, yeah.
had detrimental outcomes, right?
Horrible.
And
Yeah.
and if you really go back into history, the way the study was released is that the media released the information before the participants in the studies were informed. And that's where the disaster struck. Can you imagine being at home, being in a study, watching the news come up and it says this bad outcome is known to happen,
Yep. Yeah.
right?
Absolutely. That was such a disaster.
And that's
The
that's
Women's
what
Health
happened. It
Initiative.
was just a bunch of misinformation broadcasted really well, and then we made a medical decision going forward for 20 years, and women have been without for 20 years. And
Still
now,
plagues
you
women.
know, yeah. And unfortunately men too, right? We got to thank a few baseball players in the 80s for giving testosterone such a bad name,
Right. Absolutely.
right?
Yeah. Yeah.
I
Definitely.
mean,
Definitely.
optimal health and low testosterone levels when clinically your insurance isn't going to pay for them till you're under
Yep.
250, your risk for comorbidities increases the minute your testosterone level is under 600. So why is 250 the number, right? It's like if you're coming in symptomatic, I'm treating you. If you're coming in symptomatic, I'm treating you. I'm going to treat the person, not the labs.
Amen. I still remember the look on my provider's face when I asked them if I could get my hormones checked. She's like, "What do you want to check your hormones for? You're 32 years old." It's hard. It's hard to want to even talk to your provider. It's like they're not open to anything. And that's insurance based, of course. But let me ask you this. So one thing that you mentioned earlier about, you going through your own specific journey, and one thing that I've noticed is that because of all these endocrine disruptors, BPA's in the water, fluorides, whatnot. I am seeing women going into menopause earlier and earlier and earlier. And it's not crazy to think that a woman could potentially live a majority of her life postmenopausal, meaning at increased risk of osteoporosis, cardiac disease, neurocognitive disorders. And I just don't think that people realize this, that, you know what, it's not 50 plus anymore. There are women going into menopause much sooner. What are your thoughts on that?
So if you want to talk about the medical definition of menopause, because I think that's where some of this gets disrupted, right? So for our viewers, because they probably don't know, right? I think people use perimenopause and menopause interchangeably. So the medical definition of menopause means that a lady has not had her cycle complete for 1 year. That's it. That's the medical definition of menopause. Labs don't tell you whether you're there or not, and labs don't define it. They can confirm that that's your state, right? So like if you get labs taken postmenopausal or 1 year after your cycle, you can have an elevation in FSH and it's going to say this is the range for menopausal women, right? But that's where the medical definition of menopause ends. And then if you look at it, you can have symptoms 15 to 20 years on either side of that, right? Let's say you're one of those people that maybe didn't have optimal health and you're in the 20-year category. That means for 40 years of your life, you're suffering from symptoms that nobody is validating. That's half your
Yep.
life for a lot of people,
Yeah.
right? And if you think that the average age of menopause is 50, that means it could start when you're 30.
Yeah.
And then
Easily.
what do we do all day long? The amount of plastic that surrounded us, our lifestyle is high stress, high inactivity, like the demand on our bodies is so much more. I mean, I go to the gym every day and I still fight to get 10,000 steps in, right?
Yeah.
I mean, I
Yep.
have kids, I have a house, I have a desk
Mhm.
job, right? Getting 10,000 steps
Yep.
a day. And I'm an
Not
advocate for
easy.
health and I fall short,
Yep.
right? Getting 100 grams of protein is its own challenge, right? I do it like it's my second job, right? Protein in the coffee, protein in the bars, protein in the, it's like,
Same.
holy
I love
crud,
it.
right? It's like, but when you fall short and you're aware, imagine all the people that aren't even aware, right? Like
Yeah. It's true.
if you're not even aware that these are the things that you need to do to optimize your health, you're going to be so far in that spectrum of common that, is that where you're shooting for? We talk about labs being normal and common. And I tell people if you are using a big name lab like SonoraQuest or LabCorp, who predominantly supports an insurance based demographic, right? You're already looking at a very specific demographic of people that likely have more than one comorbidity. And when they develop those lab ranges, they're saying this is the average of the patient demographic in our spectrum. If you are shooting for an average life of somebody with 1 to 2 comorbidities, then yes, shoot for average on your lab panels, right?
Right. Yep.
But the majority
Exactly.
of us in all reality, we're not shooting for a life of diabetes and congestive heart failure, right? Unfortunately, that's a large population of America, but I think most
Doesn't
of us
have to
aren't
be.
aiming for that as our goal, right? And if we don't encourage people to have a life where that's not the goal, like where are they going to get their information from? And I can't tell you how many people I sit down and they go, "Oh, are my labs normal?" And I'm like, "Well, I'll tell you your labs are common for a 40-year-old woman who feels like you do." Right?
Yeah.
That's what I'm gonna tell
Right.
you, right?
Yep.
I'm gonna
Yeah.
tell you
That's
your
a good
labs
one.
are absolutely what I see consistently for a woman that comes in and tells me she's sweating at night, she's super irritable, and she wants to know how many people she can punt 500 yards across the room and wants everybody out of her space. Like, yes, these labs are common for you, right?
Now, you mentioned something there, Courtney, about stress and cortisol. And I know off the podcast, you were talking to me a little bit about cortisol still. Do you want to elaborate on that a little
Yes.
bit?
Yes. So I think people don't know how closely related cortisol is to their sex hormones. And I think we throw around the term hormones because we think it's just sex hormones, right? So if I say hormones, people automatically think testosterone and estrogen, and really they don't get further than that in their head. So our hormones are a very complicated cascade, okay? And I don't want to like bore our listeners with a bunch of sciencey stuff, but the easiest way to say this is that the ingredients to make cortisol are the same ingredients that you need to make your sex hormones. Your cortisol is made in your adrenal glands. These are responsible for your fight or flight response. And if you are in chronic fight or flight, like I think a lot of us are with the daily demands, your adrenal glands are pooped out. So they say, okay, we can't make any more cortisol. where else in our body do we have the ingredients to make cortisol? Because you need to stay alive, right? Your body is just there to help you stay alive. And it's going to say, you know what? You actually don't need to reproduce right now. So we are going to steal the ingredients that you would use to encourage reproduction, and we are going to put it into your fight or flight pathway, and we are going to make cortisol with it. This is a cortisol steal, or a progesterone steal, right? It comes from progesterone. And so progesterone is the first ingredient in that cascade of estrogen and testosterone. And so it says, well, I'm just going to steal all of this. And kind of when I tell my clients, I say, progesterone is bioactive, but before that is pregnenolone, right? And pregnenolone is like the flour of baking, right? You can make anything and everything with it, but on its own, it's just paste. You have to add all these micronutrients to it. So if you have pregnenolone and it's your major ingredient for the next step to make progesterone, and you take all that pregnenolone and you turn it into cortisol, you have nothing left in that pathway. And now you can't make your cupcakes and your cupcakes and your cakes. All you can make is flat tortillas, right? That's all you can make because that's all the ingredients that you have left to make. And so I find that analogy works really good to help people understand why this, like, the hormone cascade is so complicated, but why having the ability to manage your stress is so important. And sleep is one of the bigger factors for that. So when cortisol isn't being the bad guy, right? Because cortisol is actually very necessary for life, right? And it's not a bad guy. Its job as the primary function is to increase when you need more sugar in your bloodstream, right? That's the primary job of cortisol, so that you can run from a bear when you need to. And you can do all the things when your body
Survive.
says so.
Yep.
Yep. And so at night, and in the morning, you have something called your cortisol awakening response. So if you eat dinner at a normal time, 6, 7 p.m., right? All of that food is going to slowly decrease in your system, and your blood sugar level is going to hopefully drop throughout the night because you're not eating anything. This makes perfect physiological sense, right? When it gets to a certain low, your cortisol awakening response wakes you up and it says, hey, our blood sugar's too low. We need to undergo something called gluconeogenesis, and you need to start burning some of that extra stuff in your body and turn it into sugar and put it into your bloodstream. As your sugar starts to rise, that's what wakes you up in the morning, right? We need this peak because all hormones work off of a feedback loop, meaning the high controls our lows, right? So if we can't get that morning cortisol awakening response high enough, you're going to be in this really erratic wave of cortisol throughout the day, and you're going to get that 2 o'clock fatigue, and you're going to keep using cortisol instead of hormones. But what you really need to do is when you're not sleeping at night, you're basically triggering your cortisol to wake up because your body says, I'm up at 2 a.m. Do we need to run from a bear? What do we need to do? Right? And so your cortisol is working the wrong way, as in, like, every time you wake it up, it says, oh, okay, we need to do something. Well, it doesn't know that you're still just trying to go back to bed. So it spikes your blood sugar. And now all of a sudden, now you have an insulin hormone problem and a cortisol hormone problem, and you're moving all this blood sugar back and forth. And now you can't lose weight because you're waking up tons in the middle of the night, increasing your insulin levels. And it's such an interconnected web, and people just get separate.
Right. Yeah, and I love it. That was really, really well said. In fact, I've never heard it explained that way, and it makes complete sense. And I think that what a lot of people don't understand is we think that stress only happens when something bad happens to us. But guess what, guys? We're all inflamed. That we're in there because of just the lifestyles that we live. And so even though you may not necessarily be having psychological stress, your body can still be under stress. What is
Yeah.
your thought on this? Is my favorite hormone in the world, my absolute favorite hormone. What is your thoughts? Because I know you've done some content on this, on progesterone. Probably the most misunderstood
Okay.
hormone in the
So
world.
probably the most misunderstood and the easiest one to put people on with the least amount of risk and the best corrective properties, right? So, progesterone as a
Absolutely.
physiological hormone, its job in females is to protect the uterus from getting too thick and to help regulate your cycle, right? So, I think I give this spiel to all my ladies. It's what you should have been told in 7th grade, right? About the first half of your period being estrogen dominant and the second half of your cycle being progesterone dominant. 7 days before you start your cycle, your progesterone starts plummeting to the earth, right? It says, we don't need to stabilize our uterus because we did not get pregnant. So there's no reason for me to be here and stabilize your uterus. And so we are going to start coming down. And this is actually PMS, right? So some women don't experience really heavy PMS symptoms, right? They're like, oh, might snap once or twice, but I'm really very reasonable. But
Sure.
some women
Little mild.
experience awful PMS. But I don't think even women know that PMS is premenstrual cycle. This means the week before your period. And if you really talk to women and you ask them and you say, no, I want to know how you feel. I know it's very inconvenient to change a tampon and be on your period, but do you emotionally feel okay once your period starts? And most of them will be like, oh, yeah, I feel so much better. Now, there are women that are progesterone intolerant. So this is not a catch-all blanket statement. But for the majority of women, it's this. And so when women come in and they talk about their periods being really out of control, introducing progesterone to that and even picking the days in their cycle very specific to that woman is obviously sometimes life-changing for them. This is actually the hormone that controls your temperature while you're asleep, slightly different than estrogen controls hot flashes, right? So this is if you are telling somebody that you just have night sweats all night long or you sleep hot, that's most likely progesterone and not estrogen related, right? So women with postpartum depression, your progesterone plummets from the high
Yeah.
levels that it was at in pregnancy, and then you have a baby
Super
and
high
your
levels.
progesterone's right that you don't need to be there anymore, right? Because we no longer need to stabilize the uterus. Sometimes you won't bounce back from that. And it's actually really interesting. I was listening to um, another podcast and someone was talking about progesterone. And for women that are on it, we know it really helps with our sleep, right? You take progesterone, and because of its GABA receptors, you are just in this lovely, I call it my teenage, right? Like it's that comfy that you don't really care. The house could be burning down, but your mom came in and she's like, "Hey, do you want to go to school?" And you're like, "Absolutely not. I don't care what's happening today," right? Like if you're
Yep.
40 years old and you get to sleep like that again, it's honestly the most amazing sleep you've ever had, right? But after you've had a baby, you don't have that sleep. But why? Because you're supposed to be sleeping very light to get up to take care of that baby, right? Like you want to hear that pin drop. You want to hear that little bit of motion, right? But your progesterone levels stay really low. But your progesterone is responsible for your mood and your irritability and your quality of sleep. And if you want to feel like you are in chronic PMS, your progesterone levels are likely low and you can stay that way, or you can supplement, and it's usually really well tolerated. There are a few women that don't tolerate progesterone well, and you have to give it in small increments, tell them to take it earlier in the day, often find a different route. But honestly, oral progesterone is the best deliverable way. And women will wake up the next day and be like, I don't know what I took last night, but I will take it again tonight.
It's one of the things you notice right away. Like it's like the volume of hormones. Like you take it and you're like, oh my God. And believe it or not, guys, we need it too. I actually just did a whole podcast a couple weeks back. I was talking to an endocrinologist and we were talking about how when you're on exogenous testosterone, you're actually reducing your progesterone levels in men, the progesterone that's created in the testes. Okay, you're still making some of the adrenal glands, but you could become progesterone deficient as a man. So go figure, take progesterone as a guy. What? That's a girl hormone. I've been doing it
I
for over a year.
Yeah, and I've looked high and low for efficacy and safety studies for progesterone, and I can't find anything, right? I'm like, there's nobody's doing the studies because the minute you say any of the female hormones to men, we've
They're
conditioned
out.
them to think they don't need them, right? Like the amount of men that
Yep.
come into me and say, I want to be on an estrogen blocker while I'm taking testosterone. And I look at them and say, I'm going to have that open conversation with you and let you know that that's not the way I prescribe, right?
Exactly.
I'm like,
Yeah.
we can have a very
Yep.
open conversation. And if at the end of it, you want to have a discussion, I might not be the provider for you because I'm not just going to send out an estrogen
Right.
blocker for you. Like, this is what keeps you from having a heart attack. And you want to know what my best sentence to them is, why do you think women only get heart attacks after menopause? Their estrogen is cardioprotective. And like, that's
Yep.
the reason women don't, because essentially after menopause, a woman is a man with without testosterone, right? Essentially, yep, I mean, if you're looking at somebody's I mean, not to minimize women to their hormones, but I hormones are so much of your personality and your health,
It's who you
and
are.
they're all so low, you feel just horrible. I tell people, if you're not really that interested, go look at, pregnenolone, right? It's available over the counter. We can talk about that, right? It's at least the precursor to that ingredient that'll help you, because a lot of men really aren't comfortable with that, right? They want some and I don't blame you, we want data, we want studies, but now we have to get now I have to talk to people about participating in it and what does, and what does an 1100 testosterone level mean for you versus maybe somebody who's been bodybuilding their whole life and they're used to operating at, say, 2000, right? And someone, we go back and forth with these um, safety and efficacies. And it's like if your hemoglobin and hematocrit are safe and your blood pressure is well controlled and you have lost weight and now you're active and you feel better and your quality of life. I mean, we all know that our centurions, the people that live the longest, it's social happiness that is the defining key that makes them live the
Huge.
longest, right? So,
Yep.
how am I going to
Yeah.
help you live long and happy? Right?
Yep.
How do we get there?
Yep. That's true. Yeah, that's
It's a
true. And
hormone
everyone's different,
conversation.
right? Like I said, I've been on progesterone for over a year. Love it. Never had a problem. Same thing with estradiol, taking 1 milligram estradiol for about a year and a half. I don't really think it's helping me much, but it's not hurting. So the reality is
Can I
self-experimentation.
ask you something since you do that? And I've
Please.
never prescribed estrogen for a
Yeah.
man, so I'm actually curious. Do you sleep better?
To be honest, I have not really noticed much of an effect. And the
Okay,
reason I say that is because, estradiol is an endocrine hormone, so it gets aromatized at the site of the tissue. So what you see in blood work is really just spillover. It's not really
right.
metabolically active. It doesn't mean a lot. So we don't know when that full saturation point of the tissues happen unless you did like multiple serial biopsy studies. So my thought process is maybe my tissues are saturated at 70, 80. On blood work, I'll tell you, I get up as high as 120, right? Which would be an issue if my total testosterone was 500, but with me being over 1500, not a big deal. But I don't really know if I've noticed much of a difference. I think it's a net benefit of zero. I don't think it's really helping, but it's not hurting. And it was worth a shot, right? I mean, my bones got to be protected. I got strong bones now, but I
Have
think
you
that
done
it's
a
something
DEXA
that we should
scan?
look into. Never had a DEXA scan. No, no, no. I have never had one, but I
You
should
should.
look into that.
You
I could
should.
probably get
You
one
should
pretty
go get a
cheap,
DEXA
cash pay.
scan.
Yeah,
Be your
I
own
should get a
case
DEXA
study,
scan.
right? Like the first surgeon that
Yeah.
did it from appendicitis.
Yeah. Yeah. Yeah, exactly. Exactly. But I think that, we just don't know nearly as much of this stuff as we think we do. Right. And who knows, right? Like men make these hormones too. It makes complete sense, but kind of in the same vein. And this is also kind of in that same realm of taboo. What are your thoughts of testosterone for women? Is it scary?
No, okay, so no, it's not scary at all. I think the scare is from maybe women that have not been dosed correctly and followed correctly. I think because testosterone, when you don't have an optimized body otherwise, and by that I mean you are either insulin resistant or you don't have good baseline health habits, right? So you don't eat a lot of fiber and you don't work out. Testosterone converts to something called DHT very quickly. And some of those big factors are insulin resistance and a lack of a fiber in your diet, right? We have the American diet unless you're very conscientious about changing it. Because testosterone converts so easily to DHT, and DHT is the primary chemical responsible for hair loss, acne, and midline facial hair and midline hair growth, women quickly get scared of it because, oh my God, I'm a woman and I don't want to lose my hair, right? I mean, I don't. It's 100% a true statement. And most people don't actually go to talk to somebody about their hair loss until they've lost half their head, right? They don't call their doctor the first time they see a whole bunch of hair in their brush. They give it a week or two. I mean, and 3 weeks in, and if you're losing a lot of hair every day, if you haven't been very proactive about letting your provider know that you have hair loss, you're going to have the regrowth phase is going to be really hard, right? And so I think that's what scares women is that they just don't know how testosterone is causing that when it's not really testosterone, it's the metabolization of testosterone, right? So I think women
Yep.
get that scare. I think because just society created this, oh, you're going to be big and bulky and manly. I mean, I'm 5'2" and I weigh 115 pounds. I don't think that I'm big and bulky, but I am a huge advocate for being on testosterone therapy because it manages my executive function, right? And we don't give testosterone the credit that it deserves for managing people's executive function. So when I tell people, they're like, well, what is executive function? So executive function is your brain fog, right? I tell them, you think of the most powerful business suited woman that gets up in the morning, works out, makes breakfast for her kids, goes to work all day, comes home, is happy and healthy and enjoys life, can give a PowerPoint presentation to a whole bunch of people, has a good sex drive and enjoys life and can be happy. That's executive function. In addition to and I try to separate brain fog. Because estrogen is responsible for brain fog and testosterone is responsible for brain fog. And low levels of both will lead to brain fog. And this is kind of how I divide it out. And it makes sense once you do it. And I mean, obviously, this is not data proven, this is just theory, but it works every time. Brain fog for testosterone is like your ADHD, your ability to remember algorithms, your ability to teach your kid how to do algebra. Okay. Your word searching, your functionality, right? That's testosterone brain fog. Estrogen brain fog is where did I put my keys? Why can't I remember the grocery list? What did I walk into the room for? And it's very like male, female separated, right? Like these are the things that a woman has really been good at all her life, right? Like I know how to manage the kid calendar and I know all the things on the grocery list and it doesn't matter, but I can definitely remember that we are out of lemons, right? This is all of your estrogen brain fog,
Yep.
right? Your
Sure.
testosterone brain
Yep.
fog is, can I do a PowerPoint? Do I remember how to use this program on the computer? Do I have confidence? Do I have motivation, right? Can I stand in front of a crowd
Huge.
and give a speech, right? This is your testosterone brain fog. And I think when I put it like that to people, it really starts to make sense on why you need both hormones optimized. For me personally, my personal
Absolutely.
experience is that testosterone really manages my ADHD symptoms. And that's what I find it most helpful for me. And my irritability. Those two things. And I have a lot of women that come to me and be like, I don't want to be angry, right? We coined roid rage a long time ago. And bioidentical hormones have a very low tendency to do any of that, right? We really didn't do a good job educating people on what these symptoms are, right? We just didn't.
Exactly. No, we didn't. And a lot of
And
and
so
a
I'm
lot
a
of
big
women don't even know why they would want it. I love testosterone for women. It's one of the first things they notice.
right. And let's go back to the longevity, bone health, the ability to maintain your muscle mass, right? I'm a small female. I don't want to break my hip at 70 because my mortality rate, if I break my hip at 70, is 3 years, right? I'm supposed to die in 3 years if I break my hip, right?
Yep. Sad. Sad. Just
I,
should never happen. Should
yeah,
never
I
happen.
don't want to be one of those women. I want to be somebody that's still lifting weights at 70,
Yeah. Get those
right? I
bones
mean,
strong. Yeah.
yeah, I want to be traveling the world and picking up my own suitcase, right?
Yeah. I mean, like you said, right? The mental effects. Testosterone downregulates serotonin reuptake transporters. Same mechanism of action as a Prozac. Natural antidepressant. Also aromatizes to estradiol. 2 in 1, you're getting a lot of benefit there too. Increased muscle protein synthesis, increased nitrogen retention in the muscles. There are so many amazing benefits to testosterone. But libido, I can't tell you how many times I've started a woman on testosterone as part of their HRT protocol, and she's dragging her husband in saying, this guy
He's
can't
not
keep
keeping up.
up. Can you help this guy?
Well, and we casually throw around sex and libido, and the reality is that that is such an important part of an intimate relationship, and then such an important part of how you feel about yourself, right? I mean,
Yes, huge.
humans are their own weird species where we can't decide whether we're monogamous or whether we're not, and we can't decide how we do relationships, right? But I think that nobody's going to deny that healthy intimacy in a relationship is super important. And
Essential.
if that's not part of your happiness plan, like these are things that should be talked about. And who are you supposed to talk to this about? Like, right? You are supposed to be able to talk to your doctor about this, right? Your therapist can't prescribe. Don't talk to them. It's
Right.
typically not a
They can't help you.
relationship problem, right?
No,
Well, I've had women come tell
rarely.
me that they went in and talked to their doctor about hormone replacement therapy, looking for testosterone, and they said, maybe you should go on date night, right? Like,
Yep.
that's not
Yeah.
the problem.
Okay. Yeah, that's funny.
Not only did you insult me, but now you insulted my significant other that he's not or
Yeah.
she's doing a great job for
Yep.
me, right? But
Yeah, exactly.
that's not what this is about, right? Who are you going to
There's
have
so
this
much
conversation?
more to it.
So much more
There's
to it.
so much more to it. And I'm actually going to have an intimacy slash, didn't even know this existed, sexologist on the podcast here in a little bit. And they're going to talk about this specific intricacies of why intimacy is so important, because it is. I think it's a huge driving factor in a lot of relationships. And I've seen hormone replacement therapy literally save marriages, tons of them, in fact, because once again, that lack of intimacy leads a lot of questions as to, do they not find me attractive? Is there something wrong with me? And once again, you can't control those feelings. And so libido is a very, very important aspect for human health, which Courtney kind of brings me to this subject. And I got to talk to you about this because at some point you made a video saying that as guys, for our testosterone, we should no longer be cuddling. What's up with that?
I was wondering if we were going to go there. I didn't say you shouldn't be cuddling. Oh God, please. I hope nobody says that. Okay.
No,
So
I'm joking.
the conversation between men and testosterone levels is between the relationship between oxytocin, which is your bonding chemical, and testosterone, which we all know is your sex hormone chemical, right? So one drives libido up. But so this was a study done on voles. Voles are like field mice, okay? And they had studies with voles in areas of sparsity, right? So in a prairie where there was not an abundance of food. And then there was other voles, same genetic makeup, right? So same creatures, but they live in an abundant rainforest type environment, right? For lack of better words, we're going to assume that our voles are opposite genders, right? So the men in the prairies versus the men in the rainforest that have an abundance of food in women and have a scarcity of food in women, right? So if you go back to the basics of science, our evolutionary design is to pass on your genetic code, right? That's the sole purpose you're here, is to procreate and create a carbon copy of yourself, right? So in the desert voles, right, if they bonded to their significant other, they had less tendency to go out and philander and spread their seed, because the promise of keeping their genetic code alive is to stay in the home with the female and protect their offspring. They had 5 babies. They need all 5 of them to live to pass on their genetic code, right? The rainforest voles have an abundance of food in women. And so the men would go out and procreate with multiple field mice ladies, make multiple genetic offspring. And now their genetic code, they have 100.
Mm-hmm.
They don't care if the 1 or 2 at home survive. If they get 50% living, they have spread their seed well enough. So what's the driving force behind that? Right? So prairie voles, I've tried to connect this better. The prairie voles that bond to their significant other have an oxytocin increase, right? We know that's the bonding chemical. It's the same hormone that is released when women breastfeed their babies, right? It's the same hormone that is released in a woman's orgasm, which is actually not actually the same as released in a man. We can go on a long conversation about when a man's oxytocin for bonding to a female partner is actually not during intercourse. But for women, it is, right? And so we orgasm and we bond to the significant other that we are sleeping with at the time. When men bond to have their children, as their oxytocin level goes up and they bond closer and closer to their family and wife, their testosterone level inversely goes down. Why? Because it's very important that he's not attracted to other women out there. It's our genetic code to say,
that makes sense.
stay
Yeah.
home and take care of your wife and your offspring because you love them so much that you're intimately involved, right? Now, you come over here to our rainforest voles. He's out philandering and he has 0 oxytocin because he's procreating with all of these other women and he doesn't care because his offspring is like 500. Go seed the world. And so his testosterone's sky high because he's bonding less and less. So they're inversely related. It was not don't cuddle, but if you are a man and you're saying, I just had a baby and I love my wife and everything is great, but my sex drive is just in the toilet, I'm going to say that makes a whole lot of sense. And I'm not saying be less of a husband or be less of a man and stop your cuddle time. God, please don't go there. Right?
Still cuddle, guys. Still cuddle.
Women are going to kill me all over the world.
No. I was joking with my wife about that actually. Yeah, so guys, end of the, moral of the story, continue cuddling. You may just have to increase your dose a little bit.
There you go. That sounds
No, it's just so interesting. I actually do have some patients on oxytocin. I do prescribe that periodically, and they have great effect with it. They love it. Yeah. Oxytocin, I think, is another fantastic hormone that maybe is a little misunderstood, and I think we could really optimize that more than we do.
Yeah. I mean, I think as long as you've done your due diligence at making sure the relationship is safe and bonding with somebody is a very natural course of what their relationship should be doing. This is when I actually love to bring in a sex therapist and I say, hey, I would really like you to talk to this person. And if that's the okay, then let's proceed with that. Like we're collaboratively with, a sexologist.
Absolutely. It's huge. I think it's huge. You got to, because I think it's kind of something that's really taboo, but so important that a lot of people are afraid to talk about it. I will say in my experience in treating both men and women are much more forthcoming with these types of things than guys. I know guys were horrible about talking about anything related to our emotions. And so we'll just kind of disregard anxiety and depression for 1,000 different things. As soon as the penis stops working, we have a
Oh, yeah.
medical emergency on our hand, right?
Yeah.
It's time,
I always
it's
say
time to
men
get this looked at
clinic for
now, like
the three
yesterday.
P's. Men will come to clinic for three P's. They're in immense pain, their penis stopped working, or they need a physical for work. Those are the
Yep,
only reasons
exactly.
men
That's
come to
it.
the doctor.
That is it. Yep, that is the truest thing I've ever heard. So, Courtney, kind of wrapping up here, I have a question. So, for that woman out there that's listening who knows she isn't crazy and she's been through multiple providers telling her that she's normal, or this is part of aging, what do you want her to know?
To keep finding a provider that supports and validates your complaints. So you may have to look for a functional medicine provider and you may have to keep thinking outside the box. But if you know something's wrong, please don't stop. Like it may be harder to find us, but we are out there. Ask friends, use unconventional resources, use Instagram or TikTok to see who people are seeing. We're actually starting a group of us starting a DPC website where you can find like a direct primary care clinic located near you. We're working on that right now so people have a resource, and on that resource we're going to include what that service provides. Like, do they do hormone health? You may have to look for somebody. And my other thing is, don't look for somebody that only offers one type of hormone replacement therapy. And I'm a fan of pellets, so I don't mean this to downplay or disenchant the pellet therapy, right? I have lots of clients on pellet therapy, but if that's the only hormone option they offer, find a different provider, right? There is a provider that is going to look for your best interest, and that is what you need to be searching for. Somebody that says, okay, here are your options. And you may choose to do pellets, right? But there are a lot of clinics that only treat with pellets, and it's just not comprehensive care. And so that would be my one advice and my one warning.
Courtney, what's the best way for someone to get a hold of you if they wanted to be a patient or they wanted some more information on your clinic?
Yeah, absolutely. I would say my social media handles are always great. PA_Courtney. And then on Instagram, it's PA_Courtney.C. I have my own clinic in Arizona. So I'm state licensed in Arizona. So I can only treat Arizona residents, or they have to come to Arizona to see me. My clinic name is Vitalife Infusion. And then if they want to talk to me about operating DPC clinics, it's CourtneyContreras.com.
Awesome, Courtney. Thank you so much for joining us today. It's been a pleasure.